Today's topic is coping with your teen daughter's sexual assault. I'd like to introduce our expert today, Dr. Clare Albright, who is a psychologist and life coach for teens and their parents. Her screen name is Dr. Clarity. She has 25 years experience working with teens and their parents and has a son of her own to practice on. Dr. Clarity has her own YouTube channel called Dr. Clarity. Her website is teenpowertalk.com. So the first question I'd like to ask you, Dr. Clarity, is if you have a client who comes in and says that their daughter has been sexually assaulted, what is the most important thing that you coach that woman or that couple to do?
The most important thing is to give love to the young lady. I've had many friends and clients who've been through sexual assault, and I've watched what it takes for them to get back to their old well-being. And the main ingredient that they need is comfort and love. If you pretend that maybe your daughter has some kind of maybe illness, and if during an illness you would just, make sure they had hot baths and chicken soup and a glass of water by their bed, and you gently wipe the hair back from her face because you love her so much, that's really the most important thing the family can do, is just pour on the love, because this is different than a lot of other types of psychological issues that people deal with.
So after that first initial, the calming of the daughter, what does a family need to do to address this tremendous thing that she's undergone?
What I recommend, Kim, is that the family pursue expert counseling from a rape center. Even if the girl was sexually assaulted and it wasn't a full rape, the rape trauma centers, where they offer group therapy, that's the number one thing you can do for your daughter, is get her into a rape type sexual assault group if she's willing to go. If she's not willing to go to the group, where she'll get the support of hearing that the other gals in the group are feeling the same feelings of shock and inability to get back to their old level of functioning, and shame and guilt and confusion and distrust, then if she won't go to the group, then at the rape center, the individual counseling should be way better than normal counseling at another counselor. If you, for example, let's say your family's always had a counselor that you love and has really helped you in the past with maybe marital issues, usually those people aren't as amazing at addressing sexual assault as an actual specialty center is, because it's really a whole different kind of psychology. So my first advice is get her in a rape specialist group. My second advice is get her in with a rape specialist for individual counseling if she won't go to the group or in addition to the group. My third advice is if you can't find that in your area or it's out of your price range, then try to find a person who specializes as a normal counselor either in sexual assault or else in post-traumatic stress disorder, which some people call Vietnam vet syndrome, because that's the kind of psychology that I believe sexual assault drums up in a person. It's very different than normal anxiety and normal depression. And it's a different healing path. And we all know this because we saw how long it took Vietnam vets to get set free of their night sweats and inappropriate anger and overreaction to startling. So we all know that, and that's because trauma psychology is so different. So you want to get her in with a trauma specialist who specializes in PTSD. And then regular counselors, if you end up with just a regular counselor, I hope you can find one that really is an expert in sexual assault, because there's a type of counseling called EMDR. That's EMDR, which stands for Eye Movement Desensitization Reprocessing, and that's a non-drug form of counseling that's pretty quick that addresses trauma.
That's great to know. I don't have a teenage daughter, but if I did, I can only imagine the extreme anger I would feel towards the perpetrator. And I'm curious, how do families deal with that yearning to want to bring justice to the perpetrator, and what do they do?
That's an excellent question, Kim. I'm so glad you asked. What I've been finding in my friends and clients who've been through this is that the family is so feeling out of control and enraged and wanting to protect other women that they can get too carried away with that. Even though I want all of them stopped and other girls protected and these men brought to full and complete justice and even make reparation to the victim, such as paying for the counseling, what I find is that because it gives the family something to do when they're in a pretty helpless position, most of the girls that I've been around have really been stressed out and almost gotten worse because of their family rushing off to try to take care of the perpetrator. It's very confusing. If it's going to take more than a few hours of the family time, or if you're going to be talking to the young lady about it a lot, it can really distract from her healing process. So this is a very complex situation. I guess if you're going to pursue your perpetrator, which most people will want to do, you might want to keep it as separate as possible, the investigation and procedures, as you can from your daughter's healing.
Great. You know, I had a girlfriend whose daughter was sexually assaulted, and I know that she shared the daughter took a really long time to tell her, and then the mom was just really hurt that she took so long to tell her. How do you recommend that parents deal with that hurting over the length of time the gals sometimes take to talk about this?
Excellent question. I've also seen that same situation more than once, Kim. What I find is that the parent needs to get over that hurt immediately and not take it personally. It's just how young people seem to deal with their sexual assault. Most of the girls I work with don't even tell their parents. Like, I'll meet them when they're 18 and they'll tell me how they were assaulted at age 15 and had low functioning for 6 months trying to recover, and never admitted to their parents that that was the root of their change in behavior. So that's an excellent question, and my answer is that the parent just needs to quickly get over it, not take it personally, and get back in the game of giving all the love and hugs and support to the daughter's nervous system. Basically is probably completely freaked out, sort of like someone who maybe fell off a ladder or got electrocuted. You'd make sure they just had a lot of hot baths and a lot of nice sweet music on. That's really what the parent should focus on, and not how hurtful it is that the child did not trust them.
Thanks so much. That was a lot of great information for those of you listening today who would like more information about coping with your teen daughter's sexual assault. Please do feel free to contact Dr. Clarity at 949-454-0996. Once again, that's area code 949-454-0996. And thanks for listening.